My name is Gregorio Romero-González. I am a nephrologist at the German CIC Pujol University Hospital in Badalona, Spain. I'm currently working in the extracorporeal therapy unit of the nephrology department in our hospital. And also, I am a consultant in the cardiorenal medicine unit and in the surgical intensive care unit in the university hospital. In my daily practice, we use POCUS mainly as the diagnostic tool, especially focused in the correct assessment of the volume assessment in patients on acute and chronic kidney disease. This tool is not only allows us to access the congestion, but also help us to guide the descongestive therapy with either diuretics or extracorporeal ultrafiltration. That means that my mainly activity with the point of care ultrasonography is as a diagnostic tool in order to evaluate the congestion. I think that the main objective of using the point of care ultrasonography tool is to increase the sensitivity of the traditional physical examination. The point of care ultrasonography was recently called as the fifth pillar in the classical physical examination. We know that we can include the insonation as a new tool in order to improve the physical examination and our skills in the exploration. We use this tool in patients with clinical congestion, and it's mainly helped us to phenotype the tisular and vascular congestion. We strongly believe that the phenotype congestion help us to initiate personalized descongestion strategies and also wide the descongestive therapy. I think in summary, POCUS is a precision tool in the patient with clinical signs of congestion and heart failure, for example. Of course, science ultraportable ultrasound devices such as Kosmos, for example, allow us to complete ultrasound examination from the lung to the heart, including the examination of the abdominal organs and the assessment of the venous congestion, for example. And we can do all of these at the bedside of the patient. And I think that this is the very important skills for the ultraportable devices, yes, because we can take the ultrasound and go to the patient and perform a correct examination at the bedside. And by any clinician, it's not necessary an expert in ultrasound specialty or anything. I think that any clinician in any specialty can perform the point of care ultrasonography. And in my opinion, the devices as Kosmos allow artificial intelligence to support the clinician obtain great image for the correct clinical integration. That one of the main objectives of the point of care ultrasonography. In my experience, we use the artificial intelligence with the focused cardiac ultrasound because the Kosmos machine have a good skills in order to identify the correct plane in order to insonate the heart. Also, we can obtain the correct differentiation of the different structures in the heart examination. And in my opinion, it's a good skill for the people that start to learn the point of care ultrasonography because this artificial intelligence can guide the correct insonation of difficult structures as the heart, for example. We believe that the recent incorporation of this tool, although it's a simple and can be used by any clinician at the bedside, requires a basic and advanced courses, of course, in experienced centers, which can not only certify the correct interpretation of the images. However, all of these competencies should be included in the training programs of the nephrology specialties and even be endorsed by scientific societies, such as the Nephrologic Society, Cardiologic Society, Radiology Society. I think that it's important that all the specialties include the point of care ultrasonography in the training programs. The main barriers could be summarized by the clinical situation, the equipment, and the professionals. As for the clinics, the main barrier is ignore the importance of the correct assessment of for example, the congestion. I think that the clinicians not only are don't have a sensitivity with the correct physical examination, and the importance to increase the sensitivity to the physical examination. For example, I often hear that my colleagues say it's not necessary to do an ultrasound if the patients have edema, but it's not true, because the patients have tisular congestion, but we don't know if the patient have vascular congestion, and for this reason, it's very important to include the point of care ultrasonography. Obviously, it's important that the Department of Nephrology and other specialties acquire devices with the capacity to go to the patient and explore at the bedside of the patient, not with big machines in a specific place. No, it's important to go with the ultrasound to the patient. And of course, it's necessary to a correct training in the point of care ultrasonography, because it's easy. We know that it's very easy, and we can do this type of techniques by any clinician, but it's important that these people could be correctly training in a good training centers and with experienced people that can certificate these kind of skills. POCUS is recently adopted in our specialty, but anesthesiologists, intensivists, cardiologists adopt this technique in the past. That is not new, these kind of techniques. But in nephrology, I think that is very, very important that all the nephrologists acquire this kind of competence, because it's the best way to improve our physical examination. We every day have patients with problems regarding congestion, and if we increase our capacity to make a correct physical examination and increase our sensitivity of the physical examination and phenotype correctly the congestion, we can personalize the patient, and we can do a precision medicine. That is an important concept now. In my opinion, the POCUS is now, and the moment to include in our daily practice is really, really important for us.